BrainStorm for Brain Injury is a group whose purpose is to help brain injury survivors with navigating the struggles and finding the right resources for their brain injury problems. The fact that this group even exists is a testament to the numerous problems that come with this type of condition. For starters, one thing that is difficult about brain injury is even discussing the nature of the problems that come with brain injury. I think this recording does a good job of demonstrating what some of those factors are, as well as how to navigate them.
Hi. My name is Daniel Avisar. I've been helping run this building brain awareness to support brain injury recovery talk series. In my experience with brain injury and in my observation of every single person I've met with a brain injury, um, we all have problems, and we all have very specific types of problems, and we all have unique problems that are often interconnected, and it's hard to find help, but we need help, and we need the right kind of help. And I've been looking for years now at what's out there, and that's what led me to the presenters today. BrainStorm for Brain Injury is a group that is focused on providing that help and providing that support and providing that resources. And in the previous talks in this group, we've had neuroscientists talking about brain systems and clinicians talking about the specific clinical work that they do. But I think your guys' organization is really unique. Judy is a medical doctor, and TyAnne, you are a family member of a person who's had a brain injury, and so they have the perspective of seeing what kind of help we need. And in the past talks, also the misunderstanding around brain injury has been a general theme. But so I think that they have seen it, and not only do they not have the misunderstanding, which dare I say understanding, but they also are doing something to help and do something to provide the resources. There was a group like that everywhere to help everyone, but at this point, it's like just finding that this group even exists. With that, presenters from BrainStorm for Brain Injury.
So I will start. I'm Dr. Judy Gooch. I'm a rehabilitation doctor, or a physiatrist, as it's called, and for 36 years, I've worked with people with brain injury. So I'm going to start this by, I'm going to tell you a little bit more about me and a little bit about BrainStorm, and then TyAnne is going to tell you a little bit about her, and then we'll tell you a little bit about what we're going to talk about. There's endless things to talk about brain injury. Okay, so we're trying to keep it kind of focused, but feel free to ask questions. We will have kind of break stuff up so you can ask questions at certain times. So again, Dr. Judy Gooch, and so as a rehab doctor, I've been working with people with brain injury. And I am frustrated. That the healthcare system does not meet the long-term needs of people with brain injury. I am frustrated that people go to the emergency room with a concussion and they're sent home and said they'll be fine, and then they're not, and then I see them 4 years later when they're still struggling, or when they're in the house, somebody's in the hospital, the brain injury, and they're sent out and there's no follow-up. So I see the frustration big time. And so with TyAnne and with a couple other people, we started this organization, BrainStorm for Brain Injury. And our goal is to help people with brain injury find help and find hope. Because we really believe that with help, you can improve life after a brain injury. It might not be perfect. It might not be what it was, but I have seen so many examples of people improving and living good lives after a brain injury. Now, as we got into this BrainStorm thing, TyAnne is the one who's communicated with people all over the world on Facebook, Instagram, and people all over with brain injury. We have found that it is way more of a problem than we even knew. And we're too small to help everybody find help and find hope. So what we're doing now is we're trying to educate people on brain injury. Right now, we're trying to educate the mental health community. Because after brain injury, you can be anxious, depressed, struggle, and then you go to a counselor who knows nothing about brain injury, and that doesn't help. So that's what we're trying to do right now. TyAnne, why don't you talk about, tell about how you got into this?
I'm going to lead off by saying no one ends up in this community by choice. Not something that any of us ask for. It's not like, it's like shopping around for a car and then you're part of the red car club. It doesn't work that way. I got dropped into brain injury life when my youngest child was involved in an accident that resulted in a skull fracture and a brain injury, with some brain bleeds and all the things that I know probably a lot of you know that terminology. He was hospitalized in neurotrauma at the local children's hospital. They took great care of him. And then they said, okay, well, awesome. There isn't anything else we can do for you. So we're just going to go ahead and discharge you. And I didn't know that was problematic. I just, they said, well, it'll be fine. And you trust these providers to tell the truth. And it became apparent very, very quickly that my then 5-year-old child was decidedly not the same. And there were things that, oh, well, it'll just take a little time. He'll go back to normal. He'll just, you need to wait. And then there were some things that got worse. There were maybe a few things that kind of stayed the same. Maybe a couple things got a little bit better, but overall it was, even months down the road, it was very apparent that life was permanently going to be different. And so I approached our primary care doctor. I approached some of the doctors that we had seen in the hospital and said, this is going on. And I don't know. And a lot of times you get all the pat answers or they blow you off entirely. And I just got more and more and more frustrated as my child deteriorated more and more and more. And I basically felt, okay, well, if no one can advocate for him, it's going to have to be me. I'm going to have to learn, which since I wasn't the survivor and I was the caregiver and the adult, obviously, that was a much more doable task for me. And through the course of all of this, I met Dr. Gooch, and very thankful because a physiatrist is so key in brain injury rehabilitation. And I learned brain injury. I learned my son's brain injury. I'll be really, really specific there. As a matter of fact, when I started this, I didn't realize, I just thought brain injuries were, like concussions. I didn't realize that strokes fell into that category. I didn't realize that carbon monoxide poisoning fell into that category. I didn't even know really what an aneurysm was. And so I started to get more educated on what brain injury is and realized this is a significant problem. And I mean, that was like that much that I knew. And I thought, oh, this is a problem. And then the more I got into this, I was like, something really has to change. It's even more. And Judy approached me and said, what do you think? What can we do? And the goal initially was, we would like to help anybody to not endure the things that we had seen and experienced. And then through our interaction via social media, realized that this was a much more significant problem than any of us, I think, even dreamed. So Judy, when she was talking about talking to mental health care providers, saying, okay, we've got to have help. It can't just be us. We want to educate these other providers on what brain injury is so that when they have a survivor or caregiver that comes in, they can be a resource and an additional advocate for them. But in the meantime, because that's obviously it takes a really long time to do all of those things, we are still trying to help survivors and caregivers learn how to advocate for themselves. Now, me, I'm a caregiver, so I'm not like a medical provider, but I have learned a lot of ways that you can learn to advocate for yourself or the person, the survivor in your life.
Okay. I'm gonna tell you a little story about Jacob, who's had a brain injury. Then the sections that we're going to talk about is just a kind of a summary of who can help after brain injury. I'll give that. Then TyAnne will give kind of tips to help advocate for yourself. And then just a few simple things that you can do at home and on your own to help on a day-to-day basis. And I don't know what y'all know. Maybe you know all this. So if you do, great. But if not, there's just some really important, helpful little tips that have helped a lot of people. So I'm going to start with Jacob's story. Jacob, young man, he was driving his car and it was hit by a truck. It rolled a few times and hit a wall, cement wall. He lost consciousness, but just for a few minutes. He went to the emergency department. Doctor said, "Oh, you had a concussion. You'll be fine. Go home." So he went home. Now, Jacob worked as a computer programmer. He was off work for a couple weeks and then he went back. But then he noticed he couldn't concentrate like he usually could. Had headaches every day, super fatigued. Before the accident, this was one energetic guy, but now he could barely make it through a workday. So he went back to his primary care doctor and he said he had a concussion and it would clear up a few more weeks. But the weeks went by and Jacob wasn't getting better. So he started to get really anxious. He didn't know what was going on. He got really irritable. People around him, they didn't know why he was so irritable. So after about 6 months, finally, he happened to run across a cognitive therapist who treated people with brain injury. Therapist said that his concussion was actually a form of a mild traumatic brain injury, although mild is a horrible word for mild traumatic brain injury because it can have big consequences that are not mild. And she gave him strategies that would help him improve. He learned to take brain breaks, just rest his brain every hour for a few minutes. He cut back on work for a while, and this lowered his fatigue. As he began to get his energy back, he returned to work full-time and he started to exercise again. So eventually, Jacob did get a lot better, but it took him a lot longer than what it would have needed to. And Jacob, again, I mean, he improved and have other people that, continue to struggle for a long time. So who can help after brain injury? Well, first of all, a rehab doctor, a physiatrist, me. Questions now? Yes.
Okay, so there's you mentioned a cognitive specialist, and then TyAnne said often that's a speech and language therapist who has an additional training in cognitive concerns. So how does someone even, and is that how you see it? A cognitive specialist is, how do you ask for one if you're brain injured?
Yeah, first of all, a cognitive therapist, again, a cognitive therapist is somebody who works on your thinking, right? And after brain injury or after potentially other thinking difficulties, often that person is a speech and language pathologist, therapist. Sometimes it's a neuropsychologist, sometimes an occupational therapist can do some of that. They are not abundant. They're not all over the place. You're not going to find one on every street corner, and that's kind of an issue. As we mentioned before, we're trying to educate mental health counselors because they can give some of the same things a cognitive therapist could give, and there's a whole lot more of them. Okay, so the one place to look for some of this. Well, TyAnne, go. I'm going to let you say where would somebody look for a cognitive therapist? Where would they find it? In wherever they are.
So for people that are in the US, a lot of times we have insurance. It goes through managed care. Sometimes there's like managed care, there are HMOs, and your insurance has a lot to do with that. So the very first thing that I recommend people do is find out about their insurance. If you're like, I don't know how to do that. If you have a primary care doctor, start with them. They usually have someone in that is in their office that does that and can help you break down what your plan is and what it covers. So that's the very, very, very first thing to do. Understand what your insurance is. Most insurances, not all, but most insurances require that you have some sort of referral. Sometimes it's usually a primary care doctor. Sometimes there are additional specialists that you have to see so that you qualify for that service. You are going to want to say that by name. You want a cognitive therapist. If they don't know, because here's another thing you're going to bump up against. A lot of providers, a lot of doctors do not understand what brain injury is and the long-term consequences. In order to advocate for yourself, you're going to have to educate them. So when you talk to your doctor, you say, I want to see a cognitive specialist. They're going to say, I don't know what that is. Start with a speech therapist. Say, I want a speech therapist. They're going to ask for a bunch of names. Call them, call their offices and ask them, do you have experience in treating brain injury? Do you have cognitive certifications and training? It is okay to say, I appreciate your time. That's not going to work for me. If you can't find someone that does, go back through that list, or you can ask your doctor for more names. Go back through that list and see if they know any colleagues, because usually somebody does. If they know somebody that has worked with that they know a cognitive specialist, and then see if they're willing to consult.
What about Brain Injury Alliance, TyAnne?
There are brain injury alliances in most states. Now, they all function on different levels. They all provide different services. Like here in Utah, you can get a neuropsychological assessment at a reduced cost because it's a very, very labor intensive process, and that will help tremendously. But if you live in the US, that's the best way to start. Is that going to get you what you want every single time? No. And if you're not sure how to explain that and explain what it is that you need, contact us through social media. We have kind of a dialogue that, we can walk you through and say, these are the things that you want to ask for. Does that help, Nancy? Does that answer the question that you had?
That's helpful, and it's raising a lot more questions that can be deferred till later in the program.
The question in the chat, what is that assessment again? What is the nature of the assessment to get cognitive help or to get access to a cognitive therapist? I don't even know if we discussed the assessment.
Yeah, well, first of all, let me jump in for a minute. So I think that, the bottom line there with kind of so far as there's almost all states, and TyAnne, I don't know if all states, but almost all states do have the Brain Injury Alliance, so you can call, ask about cognitive therapists. You can contact, through our social media, BrainStorm for Brain Injury, and we can help guide that. And also, your perhaps your primary care doctor, realizing a lot of doctors don't know, but if you kind of push it and say, I need somebody to help, I need a cognitive therapist. Now the testing is neuropsychological testing, and that can be really helpful after a brain injury. It's a lot of testing. It's like often like a whole day, but it outlines your cognitive strengths and your cognitive weaknesses. And one thing that's so important to point out is that after brain injury, it's like, people think they're dumb, but it doesn't. Oftentimes, intelligence is fine after brain injury, and it's just it can be the mental processing or other areas of thinking that struggle. So it's important to realize that often intelligence is normal. But anyway, neuropsych testing will help outline that. And neuropsych testing, after a brain injury, most insurances pay for it. So that testing can help guide the cognitive therapy. Some neuropsychologists do the therapy, but mostly not. Mostly it's this cognitive therapy is usually a speech therapist who deals with it. But that testing can help guide that therapy. And no matter who you see, make sure that they have experience in treating people with brain injury. Okay, somebody has some comments. Go for it.
Yeah, I have a lot of years of experience with healthcare in this country, primarily focused on about half a dozen states, and a lot of experience with the insurance industry. So there's a good likelihood what you'll run into with your insurance company is they'll ask you to do an IME, which means an independent medical exam, and there's nothing independent about it. They will come up with somebody who does the neuropsych testing, and their primary function, given they're being paid by the insurance company, is probably going to test whether you are quote unquote malingering or faking it. I've been through this a number of times, and just know that you're probably better off going out and paying for this thing yourself the first time. And that's basically it.
I usually find that's an issue with workers' comp.
Well, I'm sure it is with workers' comp, but it's not going to be limited to just workers' comp.
And I know that Randy worked in this profession before his brain injury and then dealt with it as a brain injured person. And I know from my experience, the neuropsych testing did show, and I basically had lost my cognition, and the neuropsych testing did show that. But then if it wasn't for my mom and her navigating I think TyAnne explained well, there's a level of navigating and jumping through hoops to find the right help. And if I didn't have my mom to find that right therapist for me, I don't know what would have happened. And then that's a therapist who I found extremely knowledgeable. And she's like, I see her as with so much more experience than most of the other therapists I've met over the last, let's say 10 years. So it is really hard to find the right person. And I think this is all, we're getting at the point of the misunderstanding and lack of understanding and lack of acknowledgement. And then to jump through these hoops as a brain injured person is very hard to do. How are you educating health professionals? Because I think that's a huge need.
Yeah, right now we have chosen to, I'm going to answer that, and then TyAnne, I'm going to ask you to go into some of those tips because that answers some of the questions. But we have chosen to educate, target right now mental health providers, and we're just in the process of putting together material. I actually have a patient who had a brain injury, and she was a mental health. She was a counselor. She worked all over the world. She worked at Doctors Without Borders, and she set up educational material for people all over the world. So I'm working with her to develop educational materials appropriate for the mental health community. I got to tell you, I'm really cynical about the medical system, the healthcare system. I worked at Children's Hospital, and we set up a follow-up brain injury program, and it was working okay for a while, and now it just fell apart. And emergency room providers are so busy, and they kind of shove people out, and the medical system has become very acute. It is very acute oriented and very procedural oriented, and that's kind of where the money is. And so that's where, where people tend to focus. And so sorry
I
about
think
my
that cynicism, that cynicism is accurate, because I think everyone that I've spoken to has that same sort of perception of it. And in a way, I see the brain injury people as like, okay, we got to figure this out for ourselves then and build it. So yeah, I'm on the same page, and I know Randy is, and many people.
Cynicism is a polite description.
It is. And I'm sitting in the middle of it. So yeah.
Yeah, well,
I think mental health providers, I think there's, we want to, we'll start there, see how it goes. But TyAnne,
I mean,
do you want to give
can I say something here?
Yeah.
You know, all this stuff is all fine and well, but you need to keep, no pun intended, there's so many variables involved with this, from, who you were as an individual to, how bad the injury is and what was damaged and so on and so forth, that trying to navigate this thing can be a nightmare. I shouldn't say can be, it more than likely is for a lot of people.
Thank you. And we'll want to move on and let the speakers say more and follow up with questions. And TyAnne, I wrote a note. I'm hoping that you'll get to, and your tips, adults who have no advocates, because that's where the problem is the most massive.
Yes, that is a very significant problem. I want to revisit that neuropsych testing, that neuropsychological assessment really quickly. You do not need that to see a cognitive therapist. Can it direct your treatment? Absolutely. But is it necessary? No. They might recommend you get one. There might be some things specifically that they're looking for that will help them, but do not feel like that is the thing you need to go out and get, because you can absolutely receive treatment and a lot of really good, important therapy services even without that. So if you're like, I have no idea how to navigate that, I have no idea, find a speech therapist, because most of your cognitive therapists are going to be speech therapists. There are other professionals as well. So Judy actually started with who can help after a brain injury. Now, she talked about physiatrists, which is what she is. They're known as rehabilitation doctors. PM&R, that stands for physical medicine and rehabilitation. And physiatrist. It's a bunch of names for the exact same position, the exact same doctor or specialty. Okay. We outlined cognitive therapist. There are counselors, like mental health counselors and therapists, neuropsychologists. Those are the ones that usually do the testing. Sometimes they do provide treatment. At least where we are, that is less so. Usually they're not providing treatment. Usually they're just doing the assessment, but that is going to be different wherever it is that you are. Occupational therapists are a really important resource, and sometimes they have training in cognitive issues. Not always. That's why you need to learn to ask. And then physical therapists as well. Now I'm going to tell you, my son was young when he was injured, and he had no problems with his speech. He had no problems. He was very direct about telling us when he was not pleased with us, which was most of the time after his injury. But someone told me, you need to send him to a speech therapist. I'm like, well, he speaks just fine. He can swallow, he can chew, like all of the things that you would go to a speech therapist for. I didn't understand that all of those things were linked. And then someone said, he was doing all of his, or we were working on the activities of daily living. And they said, well, you need to go to an occupational therapist. They helped us with things outside of, like getting dressed and showering and all of those kinds of things. My kiddo had some pretty significant sensory integration issues. There are some auditory processing issues. And those are the additional things that occupational therapists and speech therapists can help you with. So those are some of the invisible things that you don't see. They come out behaviorally. So those are additional professionals that you can go to. Again, I'm going to agree with Rand. Is it Randy or Ran? It's on my screen as Ran.
He's Rand for short, but he's Randy. And
Okay.
Yeah, and we also had
Um,
a neuro-ophthalmologist once that was talking about those same things, because there's a lot of specialists that kind of get into, yeah, that's the thing. There's so many different types of problems, and then finding that right specialist, it's always navigating and at least jumping through a few hoops, which is very
Before we go on, TyAnne, you just mentioned about the sensory integration. There is a firm, it's called Sensory Learning in Boulder, Colorado. I went through this. It's a 2-week period of time. It's primarily directed towards people that are on the autism spectrum, but all I can tell you is that it had a profound impact on me. And it all has to do with sensory integration, and it consists of what I would call music salad, light, and a moving table in a dark room. This is very alternative. It's been around for about 50 years. And you should be able to Google it and find out about them. There are people that have been licensed to do this in different places in the country. Matter of fact, in other parts of the world. But if you Google it, it's called Sensory Learning in Boulder, or maybe it's Longmont, Colorado, which is right out of Boulder.
Thank you.
And
TyAnne, can you
there
do the-
there are some groups throughout the country. They're very, very isolated. But there are some throughout the country that they do that. We found ours. It was an occupational therapist through oh geez, I'm blanking on the, anyway, it was our local insurance. We actually call them the evil empire because they have so much control over everything. But anyway, it was through our insurance, the rehab facility that they have set up there, and we got our help with sensory integration stuff through an occupational therapist. So that wasn't like, the traditional activities of daily living. Sometimes we have to think outside of the box a little bit. Were there any questions on that before I move on what, if you're not familiar with what each of those professions, what they do? And sometimes we think, oh, like physical therapy, that's helping me with range of motion and developing my strength or maybe my balance, they do that. But a lot of their physical therapists that can help with vertigo. Didn't know that until I got thrown into brain injury life. So sometimes some of the things that they can treat they're beyond what we traditionally think of for those professions, if that makes sense.
Thank you for that, TyAnne. And what I would wonder, though, is because they have the same credentials, but some are helpful and some are not. If we could have tips for how to really find one who is helpful without, exhausting ourselves in the process and then resulting in not getting help.
TyAnne, could you go into those tips to help advocate?
Yes, I will. So I'm going to address Nancy's question first, and then so a little bit out of the order that we that I had prepared. One of the very first things, because you're right, it's an exhausting process. I mean, I'm not brain injured and was trying to do this for my child, and I was exhausted all of the time. So the fatigue that goes along with brain injury, that is a very, very real thing. One thing I'm going to really stress, if you are a brain injury survivor, there are a lot of support groups out there. Sometimes they are hard to find, but there are support groups out there. COVID and the pandemic put a lot of them on a digital format, so you can get them from all over the place. Connect with those people. For starters, it's nice to be validated. It's nice to know that you're not alone, and it's nice to hear the other things that those people that are in the same situation as you, the things that didn't work for them. It's kind of that safe space where you can vent the frustrations about the situation, but then you can get things. It's like, oh, well, this person, they did this, I'm going to try that. So finding a support group, whether it's in person or digitally, doesn't matter. If you can find something that is local to you, ask. Because we started with speech therapy, and it wasn't a cognitive, it wasn't someone that was cognitively trained. And I met the cognitive therapist that we now go to and still utilize as a resource, who's actually on our board. Found her through through a different speech therapist. So connecting with people locally and asking who they use and what services specifically they provide will save you a lot of grief and a lot of phone calls and a lot of frustration. Go direct to the source of the professionals that they have worked with and they have seen success with. Does that, Nancy, does that answer the question that you had?
It answers no, actually, it's support groups are very useful, and very few of us have this worked for me situations. So if we're looking for a professional, and some some speech language pathologists are cognitively trained and some are not, we can't just go to a speech therapist, because we might actually be harmed emotionally from that person not understanding us. And for one, I've gone through several, and I've thrown out the entire profession in my mind, not because that may not be accurate, but it was my experience and it was so bad that I'm not interested in repeating it. So the question would be, how do you know who's actually trained?
I could jump, because I don't think you can know. I think that it takes that trial and error, and that's the horrible thing about it. And it's a part where the educating the professionals out there that that could help. I've seen this, and then I've observed this with others, and then in the presentation that I did, the first one of this year's Building Brain Awareness, the National Academies of Sciences has this huge review of the situation of brain injury, and they acknowledge that too, that there's like good help and then not, and they don't, it's like there is a lack of dialogue. And one time I sat in on the NASHIA conferences meeting, National Association of State Head Injury Advisors, and I could see the good ones and the bad ones. And one of the state representatives said, so why don't we want to house them? And then another state's representative was like, don't you understand we can help them? And then it was like this weird debate, and I could see how clearly some that don't understand are just out there. So
I'm going to jump in. I think that first of all, a good cognitive therapist can absolutely change lives after brain injury. I mean, there is nothing as important in my mind as a good cognitive therapist. But you're right. There can be hard to find. There's not that many. Certainly, anybody, and this is on the TyAnne on our list of tips, ask every provider if they treat brain injury regularly. Not just, oh yeah, I saw somebody's brain injury once a few years ago. I mean, they need to treat brain injury regularly. And of course that narrows the field, makes it harder to find. But I mean, yeah, so I don't know, it's hard.
yeah, there's a question. Wendy has her hand raised.
Yes.
Am I okay to speak up? Is it interactive? This is the second one I've attended, so thank you for having me. And I work at IU School of Medicine for Dr. Hammond, Flora Hammond, and then I'm the president of the Brain Injury Association of Indiana. I preach this. I'm also a survivor of brain injury from a long time ago, but what you guys are talking about is so important, vetting resources, because funding is so limited, and a lot of the people that come to me at either my job or Brain Injury Association of Indiana have seen providers that have not, or seen something that has not been effective. They've been private pay a lot of the time. So, that evidence-based stuff is super important, but vetting is hard. And so I agree with what you said, Dr. Gooch, and everyone, that in order to vet, speaking to people in a support group and seeing what's worked for them and what hasn't, knowing that every brain injury is different, speaking to someone like your local physiatrist, speaking to someone, I know not every brain injury association is useful, or that's not right, helpful, effective, from what I understand, but the Brain Injury Association of America can help. I mean, they're not connected to one state, so they do a really good job at information and referral, but they're not going to be able to navigate through insurance and things like that, the way someone local could. So that vetting is so important. It's so hard because people sell themselves well, and some people don't know what they don't know. But I think talking to your peers, reaching out, even if you're not going to a local brain injury program, but you know that like in your state, there's a brain injury rehab program, maybe you don't qualify for it, maybe you're not utilizing it because you don't need it, but asking around, it's very difficult. So I just wanted to back up everything I'm hearing.
Thank you, Wendy. And do any of these brain injury groups do any vetting and list actual providers?
I mean, some brain injury associations that I know, some people do have resource lists. Those are really hard to maintain. We don't have one because they're very hard to maintain. What we do link to are like checklists of things you can ask people. So if you're looking for an inpatient rehab or an outpatient rehab, several states a while ago got together and created some checklists. So some useful questions that you can ask when vetting. I think what I'm thinking at a support group is talking to your peers, talking to colleagues and seeing who they've used and who has been and hasn't been helpful. At the same time, always remembering that every brain injury is unique.
Yeah, if you can just kind of plug again for physiatrists that you know, if you got a physiatrist that works with brain injury, and by the way, in our field, more people do musculoskeletal medicine, treat back pain and all that than treat brain injury. So you do need to make sure that you're getting a brain injury physiatrist. But I can tell you exactly where to go around here to get any good therapist. And you know, and if you've got somebody in your area, you know, physiatrist that works with people with brain injury, then you know, it's going to matter to them that they send you to somebody that is good. Otherwise, you're going to come back and be mad at them. So, you know, to say, hey, yeah, it's a good resource. Of course, there's nobody in rural areas, but if you can, if you are, you can even connect with somebody that maybe isn't close to home, but if you can see them even and get connected and then have them as a resource, that can be really helpful.
I feel like we kind of got the cart before the horse a little bit. I want to talk a little bit about what a physiatrist is, what they do, and why they are so important to neurorehabilitation. I want you to think of a bike tire. Okay, so we have our tire, we have the center, and then we have these spokes that go out, right? The physiatrist is the center of that. Okay, and the physiatrist is going to help you as a brain injury a survivor determine how many spokes you need. You have to have spokes to support the rest of the wheel. And our rehabilitation journey, we need wheels to get down the road, correct? Are we following the analogy? I hope. So the physiatrist is the center of that wheel. And then they're gonna look at the things that are like the questions that you're having, some of the problems that you're experiencing, like, oh, I have pain, or oh, I'm having a hard time remembering, or oh, I'm having a hard time, tying my shoes, or whatever the case might be. And the physiatrist's job, or the PM&R's job, is to say, oh, this is something that we need to send you to a speech therapist for. We're going to send you to a behavioral therapist for this. We're going to send you to whatever that specialty might be. Now, if you are really dialed in with a really good brain injury physiatrist and they've treated brain injury, they are going to know those people in your area. Okay. Now, having said that, it took us, I think, 9 months to get a neuropsychological assessment, because usually professionals that really understand brain injury, there are very few of them, and there are a lot of people that need help. But if you can find some workarounds, and then with some of the tips that we're going to give you, kind of survive until that point, that physiatrist is what's going to move. They're the center of your rehabilitative journey. If you can find a good physiatrist, they will be able to help you find the right additional professionals that you need. Does that make sense?
I think it makes sense for everyone, but the finding of it and then all the spokes being available is, as we have discussed, is it's an issue. It's hard to find. And also I know in my experience, and I have this podcast where I interview people. I've been trying to find people like me. I had the very clear feeling that my mind was not my mind, and right parietal where my brain injury was, I feel like my inner self is something that I lost after my brain injury. And the loss of self is something very real with brain injury. But I remember I had a neuropsychologist, and I also went to another professional, and they're talking to me about this grief stuff that it just didn't fit. And it was the experiences I had over the first few years made me decide to not talk to anyone anymore because it was too hard and they didn't get it. I'm just venting my experience, but I think that having the right doctor, having the right help, and then all those spokes means they also have to be good. So
Well, and sometimes those spokes, they're not just professionals. They are people in your life. They are parents, they are friends, they are that they can provide some of that emotional support. I want to, this is actually a little bit off topic for us, but what you're talking about, have you ever heard the term ambiguous loss, Daniel?
Yes.
I have
Yeah.
not, but please go ahead. Yeah, I don't know if I'm familiar with that term.
It might be worth a little bit of investigation for you. Ambiguous loss. It is not the same for me as it is for you because I am a caregiver, but my son, we're 10 years down the road from his accident. And I remember I went in at everyone that we knew told us, you need to get over it. Like your child's alive. We had a good friend that their baby died. Their baby was stillborn. It was within about 5 days of when my son's accident was. And everyone told me, oh, get over it. Your kid is still alive. They'll never even see their kid again. And my child was forever different. And all of the hopes and the dreams that you have, even for a child that's living, when the doctors tell you they'll never be functional, they'll never live independently, they'll never, all of those things, there is a really significant loss there. And it's hard to explain to people when you're like, I'm here and I'm living my life and there's so many great things about it. And everyone tells you, God, don't stop complaining, stop complaining. You hear that a lot. I think brain injury survivors and caregivers hear that probably more than just about anybody else. But that's what that is. It's definitely a loss. It's really hard to define. It's really hard to explain. And it isn't something concrete like, oh, now I have closure, because you experience that loss over and over and over and over and over again.
Yeah, that's definitely a thing. And that grieving that loss is something I've only been able to have a framework in my head around, thanks to the support group and thanks to speaking to people. In addition, as a neuroscientist, I was always viewing what's out there, and I think I literally injured the inner speech or inner thought, because I know that what was in me was gone, and it also, my outer cognition was gone, but what was in me was gone, like a clean slate, like it was gone. And there is research, and a lot of it shows very much right parietal cortex is highly involved in that inner self and inner self talk. And for me, that was actually helped me not feel crazy to know that science exists. And just like other brain networks, just like memory, just like the prefrontal cortex and reward circuits, that is a circuit. And in my mind, I know that I lost it. I've had 2 or 3 communications with the researchers that talk about that stuff and study that stuff, and they won't go on to this talk series because they don't know enough about it. But in my mind, I'm like, I lost that. And episode 15 is another person. He has bilateral parietal lobe injury, and he lost his inner self. And I feel like he and I are on the same page. So that ambiguous loss or inner grief of loss of myself, I have come to terms with that, but it took about 18 years to even get to that. But I think this thing is different, and every brain injury is different, so that for me it's a very specific thing. But well, and thanks for sharing that. But yeah,
Yeah, we have just a couple more minutes, and I just want to give a few things just over the years, things that have just simple things. And again, I don't know what you all know or don't know or whatever, so forgive me if I'm telling you stuff you know, but I think that just again, simple things that don't cost anything that have helped people, and I'm just gonna tell you what they are now. So number one, kind of don't, after a brain injury, don't overdo it. Know and respect your limits. I see people fall apart, mostly when they try to do too much. I mean, you have a brain injury and you want to do what you did before, and then you can't, and you try, and then it doesn't go well. So also avoiding overstimulation. I've got people, oh, I went to this party, I was doing pretty well, and then I went to this big family party, and now 3 days later I'm still not doing well. Also, it really helps people to keep a schedule, to schedule your day. This is like, put stuff in there and schedule in rest periods. I talked before a bit about brain breaks. I'm going to do something, then I'm going to break, and I'm going to do something, then I'm going to break. And also in that schedule, do something positive each day. Just a little bit positive, just something to make a little bit of a gain. Exercise, that I'm telling you, there are no neuroscientists that have become exercise. I mean, PhD neuroscientists, Daniel, that have become exercise gurus, because it's been shown that exercise has a profoundly positive impact on the brain. And I very much believe that.
Absolutely. And isn't it crazy how I feel like I haven't been able to find good research to show that with brain injury. There's the non-brain injured research showing the neurotrophic benefits, but with brain injury, I think it's a huge benefit, and it's hard to find evidence for that.
Yeah, and then also another thing, ask for help. I mean, we're all kind of afraid to ask for help, but I think especially probably after a brain injury, a lot of people want to help. TyAnne, I'm just reading what you had written down. Ask for something very specific, like I need a ride to therapy every Wednesday at noon, rather than just, I need help. I mean, give somebody, engage other people to help. There are, not everybody, but a lot of people do want to help. So those are just a few kind of practical things that, you may know, but maybe not. But I think there's sometimes, even some of these simple things are even underestimated how powerful they can be in helping life on a day-to-day basis. So.
And it takes time. The rehab, the changes take a lot of time. Judy, I've been watching your videos online, and can I ask you a question? Because I think before we go, I have experienced what I guess would call like you have these specific brain injury problems, and if your cognition doesn't work, and if your other focus and attention don't work, and you push it, it aggravates other symptoms, headaches, double vision, and it makes things worse. I was wondering if you could comment on that, like the way that certain problems make the other problems more or worse, or I think it's a unique thing to brain injury. And I was wondering if you'd comment about that, if you've seen that, or what you think about that.
Yeah, I will. First of all, we've got on BrainStorm for brain injury, we've got videos. I also have a YouTube channel. It's under Utah Neuro Rehabilitation, and there's a brain injury playlist, and there's a whole bunch of stuff on there too that can help from a practical standpoint. We put some of the shorter ones on BrainStorm, but YouTube, Utah Neuro Rehabilitation, brain injury. But Daniel, yeah, what you were saying, things tend to cascade out of control, and and this I especially see that with that overstimulation and doing too much. I'm going to do too much, and then you start to get a sense of overstimulation. Then you get a headache. Well, pain can make you more anxious. Pain can make you more depressed. Pain can make you more irritable. Then you're irritable, right? And then you act out, and you don't want to act out, but you act out to a family member, and then they get mad at you, and then you feel bad about yourself. And then it's just this like awful cycle. So to keep from doing that, again, it's kind of like avoiding that overstimulation. Keep a schedule, pace. I mean, pace, do stuff, rest, don't overstimulate. Try to avoid the big parties if you can. I mean, or minimize them at least. But yeah, it just gets into this, horrible cycle, and that can be very hard to break.
Yeah, and learning to not do that took me about 3 years, because you think you can do it, and also your fuse is so short and your ability is so short. Yeah, that's kind of been my observation, and living in a small world and doing only what you can, and then finding those breaks is crucial for it. And I had like a really slow growth from that for about 7 years. And then the other thing is the people that don't have support and can't take that break, or don't have the ability because they need to survive. That's a huge issue. Okay, this has been really good. Does anyone have any final questions? Otherwise, thank you, Judy. Thank you, TyAnne, because this has been, I know every one of these is kind of like a cascade of discussion and topics, but we've hit on a lot of really important stuff. And thank you everyone else for sharing. Does anyone else have any other questions?
Yes, there are 2 questions. One is, I know it was hard for you speakers to have us jumping in and asking questions, and making it hard for you to do your logical talking. So one question was, were there important points that you wanted to make that you failed to make because of our way of asking questions? And my personal question is, like, some of these things that we need to do are what we can't do because of our injury. And some of us are adults in survival mode, like Daniel mentioned, which makes it even harder to be able to ask the things that we might know need to be done. But I personally don't even speak a language that people know what I'm asking. I'm very articulate, but they don't understand what I'm saying because I'm asking questions that are not normally asked. And so I get answers that have nothing to do with the question I asked. They just give their rote answers. And so my belief is that maybe an advocate could help, but advocate is not something that I've been able to find, because my dream is that the advocate then does the vetting and all you need to do is kind of phone calling. But I haven't even found an advocate who's been able to do that. So do you help people with finding advocates? Since for some of us, that's the key to survival. And don't just tell us family members and friends, because someone that has that as an advocate is not still struggling looking for an advocate. Some of us don't have those things as possible options. And so we need to hire an advocate, for example. But that process, it hasn't been anything that I've been able to succeed at either.
Yeah, I've met many people where their family kind of just gets rid of them. And I've been helping somebody, actually advocating for him because he's in that situation. And if TyAnne or Judy, if you have any answers to that, but yeah, I know that Nancy's in that situation, and it's
Nancy, first of all, I'm sorry. I'm so sorry, and it breaks my heart. And it kills me every time I hear that, because it's not the first and it's not the last time I'm going to hear that. And So I know a lot of you don't have friends or family that you get abandoned. I know for us, a lot of our friends and some of our family walked away from us. It ruins and destroys relationships that you thought would last forever. And not only do you mourn that loss, but then you also don't have help. So my very first suggestion is, we talked about support groups. And you can kind of lean on each other for that. But the Brain Injury Association of America and the local Brain Injury Alliances, obviously, all of them function in different capacities and work on different levels. But I know for where Judy and I are, they do have social workers that they will help you. Will they do it for you? No. But they can help you with those dialogues. They can give you a few specific and targeted people they're not really vetted, and they don't have a resource list, because again, every brain injury is very different. Everyone is in a different phase of their rehabilitation journey. But that's the very, very, very first place to go. Also, there are other nonprofits that might be local to you that can help you specifically with those resources. Like Judy and I, we're Intermountain area. So do we know a lot of people in this area? Yes. It's going to be a lot harder for us because, if I'm in Utah and I know some doctors in Utah, Colorado, Idaho, and someone contacts me from Florida, that's why, and I put that in the chat, we can help you. These are some of the questions that you need to ask in order to vet appropriately. And then what Judy said is absolutely true. You need to do it in bite-sized chunks. Is it going to take longer? Absolutely. But one, you won't overly exert yourself in fatigue. And two, it's going to help you remember those things a lot better. One of the things that we did not talk about is the ways that you can advocate for yourself. My number one thing, have one book, like a 3-ring binder that it has loose leaf paper or a spiral notebook in it. Put everything regarding your injury and your rehab, all of the doctor's notes, discharge notes, prescriptions, and then a quick note. Every single visit you go to any doctor, and that's whether it's related to your injury or not. You put it all in there. Everything goes in there. It's dated. It's like a journal. And then that way you can say, oh, I was on this one medication once, I think. Well, now you have something in black and white, and you can take that to a provider, and a good provider, for brain injury or not, they're going to look through that stuff. That's going to help them provide better care for you, much more comprehensive care. So write everything down, put it in one spot. I think Judy has something that she wants to say.
I want to add it along those lines. It's really helpful to have like a 1-page summary of stuff. Okay, it's a little summary of my brain injury, medications. I mean, just kind of that 1-page summary of your medical history. And when you do address professionals, go in with your 1 or 2 top questions, because time is limited, our resources are limited, and so people are it's gonna be easier to address stuff. If you go and say, this is my biggest concern. And a lot of times that's what I'm doing in the office here, is people come in and I got this concern and that concern and that concern. And I understand this, so I can get to, if we could fix one thing, what would it be? And so that gives people something to sink their teeth into to help you. But the 1 page, okay, that makes it doable. And then your providers, your doctors, primary care, whoever, they're not overwhelmed, and they're going to be less likely to blow you off.
Nancy, I see in the chat, you said getting chart notes. That's not what I'm talking about. You're writing down your experience, your story from your perspective, the things that you are struggling with. Chart notes, doctors aren't even going to look at those. They don't even care.
Well, the patient, if the patient is trying to advocate for herself and everything's oral, that doesn't work. The patient needs those notes. And the notebook then, and I don't know if you're speaking, TyAnne, to your, my comment was about the notebook, not about the one-page summary. The one-page summary is.
No, that's what I'm talking about. That's what I'm talking about. Your one-page summary goes in that notebook.
But I'm talking
That
about
way
the
you
notebook.
No, I know. Hang on, let me get to it.
Okay,
So your one-page summary, that is going to go in your notebook. That way you tell every single provider the exact same thing. They are all working off of the same history. That's going to help tremendously. 2, the notebook I'm talking about, you get from every single appointment. Nowadays, especially, they do that for compliance reasons. They're going to give you a summary of what you talked about. Put that in there, but you need from your perspective, the questions you asked, the concerns that you took in, what things were addressed, what things were not. That way, when you walk away, like I remember, like I actually still have all of my books. I have a whole bunch of notebooks. They're all dated, so they're all in order. And go, these are my big concerns, just like Judy said. And then I know, I'm like, wait a second, I'm not leaving until I followed up with this. Does that make sense? They're going to prescribe something. You're going to write that down. And then all of the stuff that you are doing, like there was one prescription, I was talking to someone that they were put on and they responded to it horrifically, couldn't get back into the doctor, took themselves off that prescription, which is ill-advised, by the way, everybody. Don't do things like that. But they took themselves off that prescription, made a note in their notebook, because all of their personal records, their remembrances of those things, then you can take that back to your doctor and you're going to say, 6 weeks later and say, I responded really bad to that prescription. It was awful. I took myself off it. Like, well, how long ago? Because they're like medications, they have a half-life in your body. They can't put you on something else until they know it's out of your system. Does that make sense? Those are you're not just asking for those summaries. You're writing down those notes from your perspective. Does that make sense?
Really, really valuable to remind us of that.
I need to go.
Thank you, Judy.
See you,
And yeah,
Judy.
I think we can finish, and I just want to say thank you for your time and getting into all this, because it's like I look at it as problem upon problem upon problem, and underneath it is the brain injury, which is a huge problem on its own and unique for each person. So thank you for discussing this with us and just getting into all this. So I appreciate this presentation very much. I think it'll be helpful for a lot of people.
And thank you for your patience of us asking so many questions.
Oh, that's why
No,
we're here.
that was the point.
Just to spout our own stuff. We're here to help you if we can. And actually, your questions and comments have been super helpful for us. I've been taking notes thinking, okay, we need to do this, we need to do that differently. So
there's a discussion that needs to happen that somehow hasn't. Yeah,
it's been really helpful. So yeah, thank you.
Great. So if anyone wants to stick around and talk, I'll be here, but our presenters, I think, have to go. And thank you, TyAnne. Thank you, Judy. And yeah, a lot of stuff has been discussed right now. So okay, I guess I'll officially
have to go too.
Yeah, I'll officially end it, but if anyone
both.
wants to hang out and chat, TyAnne, do you have any last words or anything you want to say? Or?
No, I just wanted to make sure Nancy had what she needed. You're right. Those notes for compliance, they don't happen all the time. They don't. It's okay if you are not getting what you need from a provider to walk away from them. It's okay to shop around for. I know that the headache of trying to find a new provider is sometimes not worth it. But if you feel like you are not being listened to, it's okay to find a different provider. Additionally, take someone with you if you can, even if it's just a neighbor, and say, I need an extra set of ears. Or if a provider is gaslighting you and saying, oh yeah, no, that doesn't happen. No, if you take that neighbor or somebody and say, yeah, this is happening. I've seen her experience this. It's really sad that you need that credibility, but that will also help as well. Does that help, Nancy?
Well, once I had the experience of having an advocate come to the doctor with me, and the mere fact of her sitting there made the doctor, the physio, whatever that term is, the one that Dr. Gooch is.
Physiatrist.
That one was way more attentive because someone was sitting in the seat. However, that person sitting in the seat wasn't a successful advocate. And the doctor then, did a lot of referrals to people who weren't taking clients. And, I've had, it's just hard to have an advocate that is any more than someone sitting in a seat that causes the doctor to respond differently or the provider to respond differently. It doesn't, in my experience, it hasn't resulted in a person who can listen well, who understands what's going on to truly advocate.
You need a good advocate. And yeah, I remember the first time I was gaslit and I was so confused. And then when I left the doctor, I told my mom what the doctor said, and she said, well, that didn't happen. And I was like, well, I don't know what just happened in there. And I didn't even understand that could happen. It was bizarre. And I know, Nancy, you've shared with me your lack of finding a good advocate problem. I mean, Nancy and I talk about this stuff a lot.
But I will admit that I just had surgery on Monday, and I was more supported than I've ever been supported in my life. So I'm really grateful about that. But so much happens at once that it's really super hard. And to get people to write the notes for me when I'm in pain and I'm overwhelmed, that's really, really lacking. It seems easy. It seems reasonable. It seems obvious, but I can't get it to happen.
Another thing that you might consider, and you do have to tell people if you are going to do this, and then I actually need to hop off as well. If you have a cell phone, there are multiple apps that are voice recorders. And then you can record what someone is saying. You say, I have this question, and then let them answer, and then you can go back and review that.
I've done a little bit of that, and it's a great idea. I've had trouble making it into a successful idea, but yeah, it's another really good tip.
Well, that's one of those things that you have to practice with multiple times to find the system that is going to work for you. Like, do I ask a question and ask them to respond? Do I just record the whole visit? There are a lot of different ways that you can do it. You're going to have to do a little bit of trial and error on your part, but it's a really good way if it's hard to take notes, or you just can't take notes fast enough, or even remember the whole, because I used to like kind of do it as I went. You're going to have to find the way that works for you, but that's going to require a little bit of trial and error. It's going to require more error. Honestly, it's going to be a really frustrating process, but it can be done. So
yeah, and the fatigue, when that sets in, it makes everything harder. But yeah, I was thinking
but
trial,
if it's recorded,
error. Yeah, there's a lot of error.
If it's recorded, you can go back when you aren't fatigued anymore and re-listen to that.
Right. Thank you. Yeah.
You guys, thank you for having me. I hope you have a great rest of your day.
You too. Thank you for all that you have shared with us. Great.